With a recent surge in COVID-19 cases, Intermountain Healthcare says we're getting to a critical point. Fox 13's LEXIE Johnson tells us how the new color-coded restriction scale could help reduce the spread.
Intermountain Healthcare says right now we have more patients in the hospital with COVID-19 than ever before since the pandemic started. Right now, Dr. STENEHJEM says that there are 46 COVID patients at Intermountain Medical Center and 31 patients at St. George Dixie Regional Hospital. Dr. STENEHJEM says that it's getting to a point where overflow ICU units will have to open up to make room for more patients. He says hospital staff is running short, and this is a critical point for Utah in the surge. Now, earlier this week, Governor Herbert released a color-coded restriction scale for a transmission index, ranking counties in a high, moderate, or low risk level. This means masks are mandated and casual gatherings are limited to less than 10 people in the high risk level, 25 or less in the moderate risk group, and 50 or less in the low risk level. Dr. STENEHJEM says that these new restrictions can help to alleviate hospitals and stop the spread of the virus.
Only if people follow them. I mean, it's as simple as that. If people followed these, absolutely. I have no doubt that we would see a positive impact on our epidemic. We'd see counts come down. We'd see hospitalizations stabilize, and we'd be in a much better spot. But people have to follow them.
Dr. STENEHJEM says each county's risk level is reevaluated every 7 days. And right now he says the 15 to 24-year-old age group is improving on transmission rates, but the 25 to 44 and 45 to 64-year-old age groups are increasing in transmission rates. He says right now is the time when we need to act in order to stop the spread. He says we must continue to wear masks and limit those social gatherings as much as possible if we want to improve the transmission rates. In Salt Lake, LEXIE Johnson, Fox 13 News, Utah.